Addressing substance abuse and addiction in your community requires a comprehensive and compassionate approach. Here's how to tackle this critical issue effectively. Raise awareness and educate. Start by increasing awareness about the dangers of substance abuse and addiction. Organize educational programs and workshops for all age groups, focusing on the signs of addiction, the impact on individuals and families, and prevention strategies. Use various media platforms to spread information and reduce stigma. Provide access to resources. Ensure that individuals have access to resources and support services for substance abuse and addiction. This includes information about local treatment facilities, counseling services, and support groups. Provide resources in multiple languages and formats to reach diverse populations. Promote prevention programs. Implement and support prevention programs that target at-risk populations, such as youth and families. These programs should focus on building resilience, teaching coping skills, and offering alternatives to substance use. Schools, community centers, and youth organizations can play a key role in delivering these programs. Support treatment and rehabilitation services. Advocate for and support the availability of treatment and rehabilitation services within the community. This includes inpatient and outpatient treatment centers, detoxification programs, and long-term rehabilitation services. Ensure that these services are affordable and accessible to those in need. Encourage early intervention. Train community members, educators, and healthcare providers to recognize early signs of substance abuse and intervene promptly. Early intervention can prevent the escalation of addiction and increase the likelihood of successful treatment outcomes. Foster support groups and peer networks. Create and support peer support groups and networks for individuals recovering from addiction. These groups provide a safe space for sharing experiences, receiving encouragement, and building connections with others who understand their challenges. Engage families and caregivers. Involve families and caregivers in the treatment and recovery process. Offer educational resources and support for families to help them understand addiction and how to support their loved ones. Family involvement is crucial for long-term recovery and preventing relapse. Promote mental health support. Address the link between mental health and substance abuse by providing mental health support services. Many individuals with substance abuse issues also struggle with mental health conditions, and integrated treatment approaches can be more effective. Advocate for policy changes. Work with local and state governments to advocate for policies that support substance abuse prevention, treatment, and recovery. This includes funding for treatment programs, harm reduction strategies, and regulations that promote public health and safety. Implement harm reduction strategies. Adopt harm reduction strategies that aim to minimize the negative consequences of substance use. This includes providing needle exchange programs, safe consumption sites, and access to naloxone, a medication that can reverse opioid overdoses. Encourage community involvement. Engage the entire community in addressing substance abuse and addiction. Collaborate with local businesses, schools, faith-based organizations, and community groups to create a unified approach to prevention and support. Evaluate and improve programs. Continuously evaluate the effectiveness of substance abuse prevention and treatment programs. Gather feedback from participants and adjust programs as needed to ensure they meet the needs of the community and achieve desired outcomes. By implementing these strategies, communities can effectively address substance abuse and addiction, providing support and resources to individuals in need while fostering a healthier, more resilient community.